Hello everyone, my name is Dr. Sumit and I am a urologist, andrologist and a kidney transplant surgeon with Paras Hospital Gurgaon. Today I am going to briefly talk about one of the commonest cancer among males, and that is the prostate cancer. The incidence of prostate cancer, it is more among Asian Africans, Americans and in the Western world. The incidence of prostate cancer is not very high in Indian subpopulation, but nevertheless, it still remains the leading cause of mortality or death among Indian males. So, how does one know that one might be having a prostate cancer? In one of my previous videos, the link of which I would put with this video, I had explained what exactly is prostate gland. Well, to repeat briefly, prostate gland, it is a very small walnut shaped organ which is placed just below the urinary bladder, through which the urinary passage it passes. As with age, prostate gland get enlarged, and the reason can be either a benign enlargement or a malignant enlargement, that is cancerous enlargement. So whenever one has enlarged prostate, whether because of benign growth, which is a age related phenomena among males more than 50 years of age, or it is a cancerous growth, the symptoms are almost same. There will be difficulty in passing urine. There might be straining to pass urine. There might be increased frequency of urination. One might get up multiple times in the night to pass urine. There might be difficulty in initiating the urinary stream. Sometimes patient may have an irresistible urge to pass urine, and the urine might even leak in the underpants. There might be passage of blood with urination. So these symptoms are because of local enlargement of prostate gland, which compresses upon the urinary passage, that is the urethra, or it goes into the bladder. As the cancer in the prostate spreads, it can go to bones, leading to pain in the bones and joints. It can go to the bone marrow when the production of hemoglobin it decreases, and one might feel extreme weakness, lethargy. There might be loss of weight and loss of appetite. If you are experiencing any of these symptoms, and if you are more than 50 years of age, there is a small chance one might have cancer of the prostate. What causes prostate cancer? As I told, it is a cancer of elderly male patients. It usually happens more than 50 years of age, and in younger ages, it is very rare. I've seen a case that happened at 47 years of age and it was very aggressive. But usual occurrence of this prostate cancer is in patients more than 50 years of age. The risk factors, as I said, is one of them is age. With age, it can happen in any person. If in your family somebody has suffered from prostate cancer, your chance for getting the same cancer is higher. Smoking, it increases the risk of prostate cancer by at least twofold. Red meat, it also increases the risk of prostate cancer. Sedentary lifestyle, excessive weight, multiple other comorbidities, they again may predispose to any such occurrence. So, how do I prevent prostate cancer? Well, prevention of prostate cancer is not entirely in our hand. All the cancers they occur because of some mutation in the genes of the cells, and because of this mutation, the regulatory control of proliferation of these cells it is lost, and these cells they keep dividing in an uncontrolled manner. However, as I said, there are certain risk factors like smoking, poor lifestyle for occurrence of these cancer, so they are avoidable things to prevent prostate cancer. There are certain medications that are supposed to decrease the chance of prostate cancer by 2 to 3%. If you are at high risk category for prostate cancer, a strong family history, and you have a large prostate, you may take these medications to reduce the risk of getting prostate cancer to some extent. Even if you get prostate cancer, usually it is detected by screening methods, even if the patient is asymptomatic. And if one is more than 50 years of age, it is advisable to get annual serum PSA level. PSA stands for prostate specific antigen. This is a blood test which increases in patients with prostate cancer. The cause of increase in PSA is not just prostate cancer. Any problem with prostate will lead to increase in PSA level. So if you have increased PSA level, visit a urologist and he will most likely perform a digital rectal examination. And the prostate is felt using the fingers. If there is any suspicious nodule on the prostate or the consistency of the prostate is hard, it increases the chance of prostate cancer, and subsequently prostate biopsy is done. Prostate biopsy tells whether the prostate cancer is very notorious or less notorious. We grade the prostate cancer in being low risk category, moderate risk category, or high risk category. The low risk prostate cancer, one of the management options is active surveillance, wherein the doctor might just keep you under observation, do frequent PSA, digital rectal examination, and annual prostate biopsies to see any growth in prostate cancer. If it is growing at that point of time, the urologist might suggest you to either get the prostate removed or receive some other form of therapy for this cancer, otherwise it will progress. Certain prostate cancers, they just lie dormant throughout lifetime without ever being detected. So this definitely is an option in management of patients with prostate cancer, that we may just sit on it, but at the same time keep observing the natural history, the growth history of this cancer very diligently, and act if we feel that the cancer is now advancing. Other modalities of treatment of localized prostate cancer would be radical prostatectomy, that is removal of the prostate gland, or radical radiotherapy, wherein using radiation we just kill the cancer cells. If the cancer has already spread beyond the confines of prostate and has gone into the bones or the lymph nodes, in that case systemic therapies they are given, like hormonal therapy or chemotherapy. So this is some basic information about prostate cancer. My advice to all the listener would be, if you are more than 50 years of age, please go for annual health check and keep monitoring your PSA level, as prostate cancer is one of the commonly occurring malignancies among males. Keep a healthy lifestyle, stop smoking if you do that. You may more aggressively monitor your PSA in case there is a strong family history in your case. Exercise regularly. Intake of healthy foodstuff which are rich in antioxidants like beetroot, carrot, pomegranate, watermelon. These are all things in fruits which are rich in antioxidants. They are preventive against many cancers, not just prostate cancer. So keep them regularly in your diet. Even if you have prostate cancer, that is not the end of the world. It is a very, very, very slow growing cancer, and if it is in the low risk category, then most likely in your lifetime it may not do you any harm. Nevertheless, seek the opinion of the urologist as to what is the best management approach for the cancer that you have. Keep safe, keep a healthy lifestyle, eat healthy food, remain fit, and live long. Thank you so much.